Hey, in this video we're going to talk about nutrition pre and post surgery to make sure that you have the best recovery possible. We're going to talk about what your overall caloric intake should be. We're going to talk about the importance of protein. We're going to cover how to keep your bowels moving, and that's really important if you're having a gynecological surgery like a hysterectomy. And then finally, I'm going to give you some tips for the fasting window pre-surgery. For those of you who don't know, I recently had a hysterectomy. And in this video, I'm going to be drawing on the research I did to get ready for that surgery, but I'm also going to be relying on my background as a nutrition coach because in actual fact, there's not a lot of clear information out there as to what you should be eating pre and post surgery. Feel free to leave me questions in the comments. I will get back to you there. But especially in the case of getting ready for surgery, it's really important that you follow any recommendations given by your doctors, especially for that fasting window pre-surgery. So with surgical nutrition, your goal should be to go into surgery as strong as possible and also to maximize your recovery coming out of it. As noted in this article in Nutrients, for a patient, surgery stimulates a cascade of inflammatory, immune, and metabolic responses that result in a hypermetabolic catabolic state. So what this basically means is that your body burns a lot of calories because of the stress of surgery. The other thing that you should consider is that the more traumatic your surgery, the longer you're down post-surgery. So in the case of a hysterectomy, I couldn't do much for about 4 to 6 weeks. And then the older you are, all of these factors are going to influence your needs post-surgery and how good your nutrition is going to have to be to make sure that you recover as best as possible.
Hi baby, I'm trying to film a video here, okay? Come on.
So let's talk about calories first. There's not a lot of clear guidance as to how many calories you need pre and post surgery. But bear in mind that low calorie diets don't provide your body with what it needs on a daily basis as it is, let alone when you're going into something as traumatic as surgery. So I can't say it enough, this is really not a time for you to be in a caloric deficit. So in my case, pre-surgery, I increased my calories quite substantially because the other thing that I was concerned about was the muscle loss that can happen with surgery and then being off training for about 6 weeks post-surgery. So I actually did what is called in the fitness industry mini bulk, where I overate my calories in the lead up to surgery and I trained really hard with the hopes of at least building a little bit of extra muscle to help counteract that period post-surgery where I wasn't going to be able to train. Now, the extra training alone is a stress on the body, so I was aware that I had not only this stress of training extra, but also I wanted to prepare my body for surgery and make sure it was as strong as possible. So I had these two things going on, which meant that my nutrition really needed to be on point. My calories really needed to be enough to help deal with the extra training, but also to prepare my body for surgery. So I normally eat around 2,300 to 2,400 calories a day. Going into surgery, I increased my calories to about 2,800 to 3,000 a day, just to give me that extra energy. And overall, going into surgery, I felt fantastic. I was actually hitting some personal bests in the gym. I felt really strong, and I was really glad that I did that to get ready for surgery. So that's my first recommendation. Just make sure you aren't in a caloric deficit. Feed your body as if you're getting ready for a big event, because you really are. So now let's talk about protein requirements for surgery. There's actually a lot more information on how much protein you need when you are having surgery. Eating a high protein diet before surgery has been shown to help you recover faster, to reduce hospital stays, to keep your energy levels up, to help reduce inflammation. Protein's also needed for wound healing, and it's also needed to help counteract that muscle loss that happens from surgery and also the inactive period that follows. Now, just like calories, the exact amount of protein you need is unclear. Even the fitness industry, which has invested a lot more time into researching protein requirements, has never really agreed on what's the optimal amount of protein. So just bear that in mind. What I would say is you're going to need more protein than you probably normally consume. I did find one study that said that protein intakes of 1.2 to 2 grams per kilogram per day from high quality protein was recommended. So for me personally, before surgery, that would mean I would need about 125 grams of protein per day. And of course, it's always better to distribute your protein throughout the day. So divide that up into 4 or 5 meals depending on how you eat. Now, personally, I was actually eating more than that just because I was eating so much food overall. I was probably eating about 140 to 150 grams of protein. And post-surgery, I've pretty much kept the same diet, so my protein is still very high to help my body heal. Now, the other thing I wanted to let you know is that whey protein is often recommended when you're having surgery, and that's because whey protein is recognized as being one of the highest quality protein sources that you can have. It has very good absorbability, and it's also got the right proportion of amino acids to help prevent that muscle loss that we're concerned about with your surgery and post-surgery. Now, normally I tend to use plant-based protein powders, but because of this research and this recommendation for whey protein, I've actually gone back to having a whey protein shake every day, and that's how I've been getting my extra calories and protein in. The third thing I wanted to talk about is your digestion. Depending on the type of surgery you have, this could be really important. So for example, if you're having a hysterectomy, you want to make sure that you're not going to be straining when you go to the bathroom post-surgery. Now, my surgeon was actually really on top of this, and in our meetings before my surgery, he recommended that I either take a laxative or I eat 2 kiwi fruits every day. I didn't want to take a laxative. I think that can cause other problems. So I had the 2 kiwi fruits every day just because that was his recommendation. I don't think it made that much difference in my case, but that's because I have good bowel movements anyway. But that could be a little tip for you. He said the reason you want to take the kiwi fruits is because you just want your stool to be soft, especially post-surgery. I did a lot of other things though to make sure that my bowels worked well, and these are all just based on things that I've learned over the years. The first thing I did was to lower my fiber intake. Now, for some of you, you're actually going to need to make sure that you have enough fiber, and you don't want to do that if your surgery is like in a week's time, because you don't want to start messing around with your fiber intake close to surgery. That could lead to other problems. But if you've got a long lead up to your surgery, start making sure that you have enough fiber. That's going to help your bowels. That's very basic nutrition. But in my case, because I eat a lot of food, I actually usually have a very high fiber intake. I can top 60 grams of fiber some days, where the recommendation is usually more between about 28 to 34 grams. So I actually needed to pull my fiber down, and the way I did that is to just stop eating so much whole grains and swap it out for more white foods like white rice and pasta. The other thing is that a lot of people don't realize, but all the veggies you eat can actually create a bit more of a sluggish bowel. And over the years, I've learned in my own experience and working with clients that there are some very common vegetables that can cause problems. Broccoli is almost always number one. So pre-surgery, I would recommend not eating broccoli and probably not any cruciferous veggies. So we're talking things like Brussels sprouts and cauliflower, and also, pretty much anything green like asparagus and beans, those type of things. In the couple of days before surgery, I did cut those out. And for some people, foods like mushrooms, onions, bell peppers, those can cause problems. For me personally, I've actually learned that the strawberries, especially raw ones, and pretty much any berry actually just means that my bowels are just not quite as good and easy as I want them to be. Pre-surgery, I basically cut out all of these foods. So for the 3 days before surgery, I stopped eating any of those things, and I just switched to a very plain diet. I stuck to fruits that I knew were easy for me to digest, and I stuck to that white rice and pasta for my carbs. Now, the hospital is a bit trickier because you don't have control over the menu, but I wanted to talk you through what I did and give you a few tips. look for the high protein option on the menu. So I was really lucky with dinner at the hospital because it was chicken breast, baked potato, and steamed veggies. So that was perfect. And the veggies were actually easy to digest. Breakfast is pretty standard. I think in hospitals you're gonna get things like oatmeal, and they do give you some fruits like dates and that kind of stuff, which is great for helping your bowels move. I had actually packed my own protein pancakes, so I didn't even bother with the breakfast. That's the other thing that I've found over the years, is that if I stick to my own foods that my body's used to, my bowels work better. So I had brought my own breakfast with me. And then the problem that I encountered at the hospital was actually lunch. They only had raw foods on the menu, so they had salads and they had wraps. And the thing about raw foods is that they can be really hard to digest. So I would also recommend probably not eating those in the lead up to your surgery, and I definitely wouldn't eat them in the hospital. I was a little bit disappointed that that was the only option, because it doesn't seem to make sense to me when you have so many people in the hospital having things like hysterectomies where they need their bowels to move. You need food that's easy to digest. So I actually skipped lunch, and I had a protein bar that I had brought with me and pomegranate juice that I had also brought with me. So I had packed these great protein bars that are made from egg whites, and they have dates in them as well. So I was getting two things in one. I was getting my protein, and I was getting some food that would help keep my stool soft. And so that's another tip for you. Don't be afraid to pack your own food. So the final thing I wanted to do was give you a couple of tips for that fasting window pre-surgery. Now, it didn't make sense to me to go into something as stressful as surgery in a fasted, weakened state. I wanted my body to be as strong as possible. When I was doing my research, I came across something called the Enhanced Recovery After Surgery Protocol. In this protocol, they talk a lot about carb loading pre-surgery and about how traditional fasting might be too aggressive, and how patients actually feel better and have better recovery when they have a bit of carbs in their system pre-surgery. So they talk about maybe having like some fruit juice and stuff in the lead up to surgery. But I still wanted to follow my doctor's advice, and my advice was to stop eating at 2 a.m. So I didn't have the option of having fruit juice a couple of hours before my surgery and that sort of stuff. So I actually had to create my own sort of way of making sure that I went into surgery as strong as possible. And what I did was draw on my background as a nutrition coach and treat it more like an athletic event. So the day before surgery, I did some carb loading just like an athlete would do. And I overate my calories quite a lot. So in the lead up to surgery, my calories had been about 3,000 per day. The day before surgery, I ate about 32 to 3,300 calories. I was pretty full. I ate a lot that day. And the night before surgery, I had my dinner very late. I ate it around 9 p.m. and I had a huge plate of pasta and a little bit of meat sauce. So I wasn't eating a lot of veggies again, so my digestion was going to work well, but I really wanted to get those carbs in. And I also had a glass of juice. So that was a super high carb meal. But even then, my surgery wasn't scheduled until 11:30 the next day, and that was going to be a long period of time, about 14 hours without eating, and I didn't want to go that long without eating. So I actually set an alarm for 1 a.m. and I made a big protein shake before bed. I made a 500 calorie whey protein shake with some oatmeal, some protein, some peanut butter, and I put that in the fridge. I set my alarm and I got up and I drank that in the middle of the night. It was a bit of a hassle to get that big shake down in the middle of the night, but I was really glad I did that, because the next day I felt so much better than I expected to. I'm not somebody that does well skipping breakfast, and I felt really solid all morning, and I didn't feel hungry going into surgery at all. So I was very glad I did that. The final tip I wanted to give you is that I was actually allowed to have a black coffee pre-surgery, and I took advantage of that because I wanted to have a bowel movement before we left the house. So in the morning, I got up and made myself an espresso, because as you may know, coffee can really help move the bowels, and that was something I was concerned about going into surgery. So there's another little tip for you. You might want to have that coffee if you're allowed to. So I hope you found that helpful. One more thing I wanted to let you know is that I found that there wasn't a lot of good advice about what you should do with exercise post-surgery, especially post-hysterectomy. And so I have created a comeback program for people who need some help getting back to training after surgery. I'm going to leave a link to that program in the description of this video, and you can check it out, and you can always message me if you have questions about whether it would be appropriate for you. And the final thing that I wanted to say is that for those of you who watch my videos regularly, you'll know that Nero, my cat, usually pops on screen about now and helps me sign off. Before filming today, I managed to get him to do some tricks, so I'm going to leave you with some videos of that. Thank you so much for watching, and I'll see you again next time.
Ready? Ready to do your trick? Ready, buddy? Okay, come on, ready? Ready? Come on, ready? Woo! Good job, Nero. Ready?